morning, everyone. I wanted to take an opportunity today to highlight some of the things that are going on with COVID-19 in October of this year. I think it's important for you as healthcare professionals now, or budding healthcare professionals, to have a slightly different angle on what's going on and to kind of review a little bit of the science and where we're at from a medical standpoint. So COVID in 2020, the science. The reason why I want to talk about the science today is there's a lot of myth and rumor that seems to have leaked out into the news and into the media. And it's important as healthcare professionals that we recognize and separate the science from the myth that's out there. You are going to go about a change in your life over the next year or so once you become practicing paramedics, and it's important that you start looking at literature and healthcare in a critical and an important different way. And when I say the science versus not the science, what I mean is this is not science. There's flat worlders out there, and there's a lot of people that think this COVID-19 virus is a hoax and a plot. And in fact, we all know that that's not true, but it's important that you understand as healthcare professionals what this all means. We are now in an era where there's a great sharing of information. 30 years ago, medical science was nowhere near as advanced as it is now. Because of the internet and the ability to share information, we know far more about this virus now than we would have even 15 years ago. And the science of it has really evolved rapidly, although our cure rate is not great because of the development of medicines. We're, from a science standpoint, well into understanding the virus. The next slide I'm going to show you is from Scientific American. It's a great magazine for the general public and for some folks who are new in healthcare because it gives a little bit more basic information than some of the other magazines out there. And if you look at this virus, you can see that they've broken it down into component parts, and there's a lot of different component parts. This is on the level of a few microns, and they've already been able to isolate it under electron microscope and break down the chemistry of it. And as you can see there are different proteins on the outside of the virus that help the body to recognize it, particularly the S spike, which is what makes it attached to the body. There's an envelope, proteins that make up the envelope, and then inside the RNA. And so I just wanted to show you this diagram. I don't expect anybody to memorize it, but I want to let you know how far into this virus we are and what we've been able to understand about it. The important thing about looking at this diagram too also is that the makeup of the virus is what allows us to develop drugs and vaccines that prevent either its replication or prevent it from entering the respiratory tissue. So understanding this is essentially the premise of every kind of medical therapy that will come along over the next few years. So why is science important to you right now? I really want you to take this to heart. You are embarking in a completely different new phase of your life. Once you start rendering care to patients, you have crossed the threshold from being a civilian to becoming a healthcare provider. And it's important that you understand what's going on, what are myths, what is the truth. This is the largest healthcare crisis that we've faced in more than 100 years, and it's going to have an impact on every aspect of our lives for several more years. One of the things that the CDC announced just today, and this is October 6th, is that they're confirming that the virus is airborne. So how does that impact us? Well, from a societal standpoint, it means that we're going to have to be even more careful than we were before. You've got to be very careful about where you go out in the public. how you protect yourself, how you protect your family, making sure you're not inside a closed environment because the virus can hang in the air much longer than we suspected. And I think many of us in healthcare, certainly Alex and I, have realized over the past several months that we knew it was airborne. And the reason is healthcare workers getting ill in ICUs despite wearing PPE all the time. You walk out of a patient's room, you close the door, and it's invariable that if they're not in reverse isolation rooms with reverse flow, that the virus can still be out in the air. So it's important that as we go along and we discover more about this virus, that you folks stay informed from valid sources that are scientifically based, and that you take your information from sources that are valid and scientifically based. So I'm going to talk a little bit about where we are today. Currently, we're at 7 million cases in the United States. We're at 210,000 deaths as of today. The curve seems to be climbing. About a month ago, mid-July and August, it was climbing dramatically in Florida in the South. That peak has changed. What's happened is they have become more aware, and the peaks in the ICUs and in some of the hospitals dropped off. Sadly enough, because there was a decreasing in restrictions in the north, there's been an increase in cases. And if you look at the map of where cases are increasing now, it's literally flipped 180 degrees over the past couple of weeks. So cases are increasing in the Northeast and the Midwest and in the Northwest. So what are the implications of that? Well, the implications are New York, for example, is talking about shutting down some of the openings they did. They're actually doing it by zip code because we're able to track the outbreaks by zip code now. Newton, Virginia, now New York's able to. So they're going to increase restrictions in certain areas. I think this resurgence is worrisome, but it brings us back to the whole public health area of this, of what do you do when there's a contagious airborne virus? You have to shut things down. You have to get everybody to wear masks. You have to socially distance. You can't be in crowded environments. And so there's going to be an evolution of this as it goes on over the coming months. We're finding a similar pattern in Europe. England's found a resurgence, France has, Germany, and certainly Italy. And again, I think this is what we would expect once you relax the public guidelines. And everyone is concerned about this as we go into the winter. Because as we go into the winter, people are inside. There's less social distancing. People are forced to be closer together, even with their families. And so we would expect this to increase even more over the coming months. So we're at about 300 deaths a day in the United States. That number is bound to go up. How do we flatten the curve? And what do we do now that the flu season's upon us? So I'm going to talk about flattening the curve a little bit just so you understand. What this is a graph of the number of cases and healthcare capacity. When we say we're flattening the curve, we're not eliminating cases. We're adapting the healthcare system to take care of the number of cases. And if you have folks out there not using protective measures, you see huge spikes in the number of cases that overwhelms the hospital system's capacity to care for those patients. When you use protective measures and you flatten the curve, you still may have the same number of cases over a longer period of time, but the healthcare's capacity to take care of those cases is improved. So when you're wearing a mask out there, it's not to necessarily save yourself, but it is to protect other folks. And so, as Fauci would say, you do this for your grandmother, you do this for your family, you do this for the other members of the community. And I'm hoping that the episode over the last couple of weeks in our leadership changes the course of some people's behavior. but it's important that folks understand it doesn't necessarily eliminate cases. It allows the healthcare system to accommodate those cases. So the next thing I'm going to talk about is how SARS works and why it's so important. I'm not going to go over every step of this diagram because it's pretty complex, but essentially lets you know that when SARS infects the body, it typically goes through the nose, the respiratory tract. There is some evidence it can be going through the eyes. It enters the cell, it replicates itself into thousands of copies and comes out. When it comes out, the body has an immune response that is multi-tiered. If you've taken immunology, you realize there's different types of white blood cells, including T helper cells and B cells. The B cells are the leukocytes that help make antibodies. The antibodies can attach to the virus and they prevent it from re-entering the body and also help generate more memory cells that can help fight the virus off. Like I said, the diagram is fairly complex, but it's important that you understand the basics of it because all vaccines and all medications that are going to help alleviate the severe effects of this will be based on this diagram. The key one up there being the B cell making antibodies, because once those antibodies attach to the virus and attach to those S spike proteins, it prevents it from entering the epithelial cells in the respiratory tract, which is what sets off the infection. And most folks understand this, but it's important that you know the major cause of morbidity and mortality with SARS is from a respiratory standpoint. So common sense public health measures, now that we know this is airborne, this is even more important. Social distancing, why is that important? It's how far the virus can go. We suspect it goes further than 6 feet now, but 6 feet is the bare minimum. Wearing the face masks helps prevent you from getting the virus and also helps prevent you from giving it to someone. We know now that single layer cloth masks or these cowls that people are wearing or a single layer of a bandana, not effective. We know that cloth masks, for them to be effective, have to be 2 layers. They need to be washed daily. Surgical masks are more effective than cloth, and the gold standard is N95. If you're in an enclosed environment in healthcare, then you need a PAPR, which is a self-contained device. Hand washing, obvious. Everybody should be doing this at this point, or using a some sort of a hand sanitizer. Hand washing, they say, for 20 seconds. Avoiding crowded areas, obviously, is important. I want to talk a little bit about some of the practices that Alex and I do when we come home from work. If you're out working in the healthcare environment these days and you come home to what I would call a house of folks who are not exposed, I leave my clothing and my shoes in the garage, or you can leave it in your front doorway in a basket. I go and take a shower immediately and change into clean clothes. What I'm trying to do by that, and I'm sure Alex does and most of us, I took a poll of some nurses, they're all doing the same thing. We're trying to decrease the risk to our families. And now that we know this is airborne, I think it's even more important that you do that. So I know many of you folks run with rescue squads or with paid agencies. And I think it's important that you understand that a lot of us in the healthcare community are doing that. And we're doing that because we think it's the right thing to do for our family. So I'm going to talk a little bit next about the vaccine. I think I've mentioned this to a few of you. I have decided to be a participant in a phase 3 clinical trial. One, because I'm at risk because of age, exposure, and pre-existing medical conditions. And 2, I think it's the right thing to do. So I'm in a phase 3 clinical trial right now with Moderna. In fact, I get my second vaccine tomorrow. There's multiple clinical trials going on, and there's multiple clinical trials looking at various different aspects of how to prevent the virus from replicating. I'm going to show you a slide in just a minute of it, but just to understand that there's not just one trial going on. There's many, many trials going on with many, many different ways to attack the virus. Moderna's trial has got 30,000 people enrolled. They've established that it's a safe vaccine. But what we need to do next is to figure out efficacy. And I'll talk about that in just a bit. So these are the other clinical trials that are going on for vaccines. And you can see that they are a mixed bag of who's doing them. Industries responsible for about 66% of them. There's public-private partnerships, and then there's vaccine trials that are going on with just academia. Academia being large university-based systems that are doing it. And if you look at the types of vaccines, you can see 157 different types. There's a huge variation in what they're doing. Some are doing RNA vaccines. Some are doing subunits of the virus. Some are using different vectors to see how they can get the virus into folks. There's some live attenuated vaccines and inactivated vaccines. Live attenuated means it's a vaccine where the virus is still alive, but it can't cause infection. And an inactivated vaccine is essentially broken up components of the vaccine. And you can see below there, it lets you know, this was as of late July, what vaccines were out there and how far along they were. And you can see there's only a couple in phase 3 clinical trials at this point. With the vaccines, we know that they'll establish antibodies. The question is, do the antibodies prevent disease? And that's what we don't know. And how long do the antibodies last? Well, we know that there's some folks out there that have gotten COVID twice. It's a very, very small number. But right now we know that we're hoping it lasts for 3 months. The current vaccines trials that are out there, you need to get 2 vaccines separated by 4 weeks. And so when we talk about producing this vaccine, if you've got to get 2 doses and there's 330 million people in the country, it's a massive, massive undertaking to do this. The trial that I'm in, I'm just using this as an example because it's the one I understand. Moderna's trial is involving messenger RNA. It's injected into the body. The RNA interacts with intracellular ribosomes and produces the S protein that is on the outside of the virus. That protein is then secreted out into the body, generates an immune response from white blood cells. Those white blood cells and the B cells make more antibody against that S protein. And so that if you get exposed to it, that protein that's bound by the antibodies can no longer attach to the epithelial cells in the lung. And this is kind of how that works. You can see the antibodies there. What happens is all those spikes that are on the outside of the cell get blocked by this protein antibody, and it helps prevent it from attaching and then entering cells in the body. And so it's a very complex process. And obviously you need a lot of antibodies to do that if you get exposed. So it's important that you get an adequate immune response. This is another thing that's important for you to understand. When we vaccinate folks, we want to know, is the vaccine efficacious? We know it's safe, but now is it efficacious? And that means, does it prevent disease? Now, how do we figure that out? Well, we figure that out by getting a placebo group and the group that actually gets the vaccine. Placebo is obviously something harmless that doesn't cause immune response, and then the vaccine. And then you have to go out and survey these folks weekly, which is what happens to me, and find out if they've, 1, been exposed to the disease, and 2, if they've gotten sick. And this can take a long period of time because you've got to compare, did the vaccine folks get less infections than the placebo group? And if the vaccinated group does not get less infections than the placebo group, then the vaccine is not efficacious. This doesn't take a couple of weeks. This doesn't happen by November 3rd. This happens over a long period of time. And so what's going to happen over the next coming months is the vaccination companies are going to get together with the FDA and say, listen, our data shows that this works, and we're not seeing infections at the same rate as we are in folks that are not vaccinated, or there's no difference. It's important that we figure that out, though, because if we go through the expense and trouble of vaccinating folks and the vaccine's not effective, how willing are these people going to be to take a new vaccine that we say is now effective? So important data needs to come out before we decide which vaccine works. We're already having an issue in the United States with people not wanting vaccinations. In fact, they did a survey because of distrust with the government right now. 52% of the population said they wouldn't take a COVID vaccine. That's a frightening number when you think about it. So it's very important that the trust is established between the vaccination companies and the public before it's released. So this will be very interesting to see over the coming months. So make sure you understand the difference between efficacy and no efficacy, and that's what we're going to hear the numbers for, and that's what you'll hear Fauci talk about. The next thing I want to chat about a little bit is the flu vaccine and why it's so important in 2021. The biggest reasons are the following. It can be a comorbid factor with COVID. So let's say you get the flu and you get COVID. That's kind of the double whammy there. And a lot of folks are having a hard time coping with COVID with a pre-existing condition. Put the flu in there and it makes it very difficult. It also makes it difficult from a hospital standpoint because the number of infections will be up. And it's also, the flu has somewhat similar symptoms to COVID. And so every person who comes in with a low-grade fever now is going to get COVID tested and flu tested, and it's going to muddy the differential diagnosis a bit. And it's going to make it a little bit harder for us as healthcare providers, physicians and paramedics, pre-hospital people and hospital-based folks into determining what's going on. Another interesting portion about the flu this year is because folks are wearing masks and because folks are being a little bit more careful, we may see less of the flu this year than we did in previous years. Hand washing has always been an important part of mitigation of the flu. And it looks like wearing a mask maybe make a difference as far as flu transmission. So we may see a decrease in the number of cases of the flu, and we may see an increased vaccination rate. I'm sure if you're in any healthcare environment now, your employer requires you to get the flu vaccine, and I can't simply stress enough the importance of it. You're going to have to do that just as a public safety method. You can get it at any store these days that has a pharmacy. CVS is doing it, and most of the other places are as well. If you get the vaccine there, make sure you get some documentation of it. I want to get into addressing a couple of myths out there. There's a few myths where I don't care if people believe it. The next two are damaging to the medical community and to you as healthcare providers. So the first one is that there's doctors and nurses that are forging death certificates to say that coronavirus is a cause of death to increase reimbursement. When I first heard this, I was like, well, nobody can possibly be believing this. As it turns out, some of my daughter's friends believe this. So that was pretty shocking to me. And so, just so you know, if we did that, if that was going on in any degree, one, it would be reported, and two, I would lose a medical license, and most people would. And so for people to suppose that that is happening, it's simply not true. It's Medicaid fraud. It's a violation of your oath and your license. And I'm pretty convinced you'd go to jail for it. So there's no evidence anywhere that that's happening. That's a complete rumor by conspiracy theorists. So let me just reassure you, no one is forging death certificates. So the only other one I'm going to address quickly is this one, that only 6% of the deaths that are reported by coronavirus are actually by coronavirus. So there is a hint of truth in this statement, but only a hint. Of the deaths that they've seen so far in the United States, 6% of the folks only had coronavirus and had no other comorbid conditions. Well, we kind of knew that based on Italy, because Italy found that an elderly population that had hypertension, previously smoked, or some other medical problem were at increased risk. And so that's true. That's true. There are 6% of the cases who didn't have anything else. But it doesn't mean that coronavirus wasn't the cause of their death. And I'm going to give you an example of this. So let's say you have hypertension. I have hypertension. I get coronavirus and I die from it. Now, did hypertension cause my death, or did my respiratory failure from overwhelming inflammation cause it? Well, coronavirus caused my death and I had hypertension. And so when they write something down on the death certificate, it'll say coronavirus, respiratory failure, hypertension. Doesn't mean that hypertension caused the death. It means it's a comorbid factor. And so it's important that you understand that. And that's true. Let's say somebody had, a form of leukemia. They've got CLL, which in CLL is one of these leukemias where the patient usually outlives the disease. But they get coronavirus. Now, coronavirus causes an overwhelming respiratory failure. Did they die from coronavirus or from CLL? They died from coronavirus. CLL was a comorbid factor. So it's important that when people are trying to discount the morbidity and mortality of this, you don't let them parse it out and say, well, there's a lot fewer deaths. There's not fewer deaths, but the people who are at risk are contributing to those numbers, but coronavirus is still the primary cause of death. So takeaways from today's discussion. We're probably only the first 3 innings of this game. We're seeing a spike in cases. We're going to see a spike over the coming months. Winter's coming, not to quote Game of Thrones, but winter is coming and people will be inside more. And so we're going to see increased transmission rates and increased mortality. There's certainly folks out there who are saying we could see 400,000 deaths by Christmas. I'm hoping we don't see that. I'm hoping that people are a little bit more careful. But we're in the very beginning of this. Public health measures and vaccines are the only thing that's going to reduce the number of coronavirus deaths. There is a myth out there that herd immunity will ultimately be what stops this disease. I would hope that's not true. Herd immunity, if it's from a vaccine, would be great, but herd immunity from people acquiring the disease would be a very awful process. To get to herd immunity, you need a minimum of 50 to 70% of the population infected. And we're still looking at 2 to 3% death rates. If you extrapolate that into the United States population, we're talking millions and millions of deaths. So we are hopeful in the medical community that the vaccine will come out, be efficacious sometime after the first of the year. People follow public health measures, and that we see a decrease in the case rate increase. And I think everyone who's informed in the healthcare community can agree on this. It's certainly what Fauci and the folks from NIH are talking about. So I want to reemphasize that now that you're becoming a healthcare provider and a paramedic, you're at a different level than you were 10 weeks ago. You are now rendering healthcare to folks who are in desperate need of what their medical condition is. It's important that you're informed, that you take what you hear and see and look at it critically. If you're going to read an article about coronavirus or anything in the healthcare community, you make sure it's something that's peer reviewed. That means somebody else in the medical community has reviewed that article and agreed with its findings before it was published. And they said it's a valid article. And so I want you to be very critical about what you're reading. The other thing I want you to do is to model the behavior that you would like other folks to do. Avoid risky behaviors that puts yourself and your family at risk. Make sure you're taking all the precautions with your PPE. One of the things that we're seeing in the healthcare community is what we call PPE fatigue. And that simply means that folks get tired of wearing it. They get lax, they take off their mask, they get too close to a neighbor, they have lunch with everybody they're working with 5 feet apart, and all of a sudden 3 people out of the department or out of your organization are sick. And so you need to make sure if you're eating with your coworkers that you're sitting far apart so that you're not exposing each other. And the last thing is resources that are legitimate. These days, New England Journal, the Journal from the American Medical Association, Scientific American, Nature Magazine, Immunology Today, and Lancet are all valid places to get your healthcare information from and the science information. Make sure that when you're reading articles from any other source, you make sure that they have some medical legitimacy and they're not coming from someone who's not well informed or not from the science community. Alex, I'm sure, has got my number, but if anybody wants to email me, please feel free to email me at mfranke@cox.net. This is a small class this year, and I'm very comfortable if you want to email me with any questions about coronavirus or anything in EMS. Have a great day. Look forward to seeing you guys this week.